Howdy, and thanks for learning about health insurance with me, Aaron Boster. Health insurance in the United States can be downright overwhelming, and yet it's critical that you understand at least the basics so that you can make the best choices for you and your family. In this video, I'm going to try to decode healthcare and health insurance for you, going over the basics of how it works, sharing with you important terms to understand, and importantly, sharing tips to help you navigate the system. Don't turn away because all of that starts right now. Hey! So what is health insurance? Health insurance is essentially a contract between you and the insurance company. You pay a premium, and in exchange, the insurance company helps you cover medical expenses, from routine checkups to unexpected emergencies. You can conceptualize health insurance as a safety net for your health, helping you manage the cost of your medical care. Let's break down some essential terms to help navigating health insurance a bit easier. Number one, what is a premium? A premium is the amount that you pay, typically monthly, to maintain your health insurance. Number two, deductible. This is the amount that you need to pay out of your pocket before your insurance starts to cover certain agreed-upon services. Number three, copayment or copay. This is a fixed amount that you pay for a particular service, like a doctor's visit. Number four, co-insurance. This is the percentage of costs that you're going to be responsible for paying after you've met your deductible. Number five, out-of-pocket maximum. This is the absolute most that you're going to pay in a given year before your insurance picks up 100% of eligible costs. And number six, a network. This is a group of doctors, hospitals, and other providers that your insurance plan has contracted with to provide you with care at a reduced rate. Health insurance typically include the following components. Number one, preventative care. Many plans cover preventative services, things like receiving vaccines, screening tests, annual checkups with your doctor, and they're often offered at no cost to you. Number two, in-network versus out-of-network. Using in-network services usually costs less because the insurance company has contracted with those in-network services to reduce the cost. Out-of-network services are oftentimes either not available to you or you have to pay more money to have access to them. Plan types. The first one we'll talk about is called an HMO, or a health maintenance organization. These require you to use in-network services almost exclusively, and they require you to receive a referral from your primary care in order to see a specialist. Next, we'll talk about a PPO, or a preferred provider organization. These plans often are more flexible in which providers you're allowed to see, and they don't typically require referrals to see a subspecialist. And last, HDHP, which stands for a high deductible health plan. These plans typically have a lower premium that you pay each month, but a higher deductible to access services. And they're oftentimes paired with what's called a health savings account, or HSA. This is where you put pre-tax money into essentially a credit card, if you will, and then you use it when you tap healthcare resources. When selecting a plan, here are factors that you need to consider. Number one, what is the monthly premium? In other words, can you afford the monthly cost to maintain that insurance product? Number two, what is the out-of-pocket cost and what are the deductible costs? So how much are you going to need to pay before that insurance kicks in to cover costs? Number three, coverage needs. What does the plan actually cover? Does it pay for the medicines? Does it pay for doctor's visits? And does it pay for ongoing treatments that you need? Number four, what is the network? Are your preferred providers in that network and available for you to see? And lastly, additional benefits. Some plans offer perks, such as allowing telemedicine services and wellness programs. So where can you obtain health insurance in the United States? There's typically three different sources. Either employer-sponsored plans, private plans, or government plans. Let's talk about all three, starting with employer-sponsored plans. So most people in the United States who are working obtain insurance through their job, oftentimes sharing costs between the employer and you. If you are unemployed or if your employer doesn't offer coverage, then you can oftentimes purchase a private insurance plan through the health insurance marketplace or directly from an insurer. Number 3, there are government plans. These include things like Medicare and Medicaid, two government-run health insurance programs within the United States, and they serve very different populations and they have different purposes. We'll start by talking about Medicare. Medicare is primarily available for individuals over the age of 65 or younger individuals with certain disabilities and chronic conditions, things like end-stage renal disease. Medicare is divided into 4 parts. Part A covers hospital stays, skilled nursing facilities, and some home health care. Medicare Part B covers outpatient care, things like doctor's visits and then preventative therapies. Part C is called Medicare Advantage. This is an optional plan which is offered by private insurance. It oftentimes bundles Part A and Part B and then can include extra benefits. Medicare Part D is what covers prescription medications. Funding for Medicare is provided through federal payroll taxes, premiums are paid by enrollees, and federal government revenue. It's a federal program, so it's standardized across the entire United States. Now let's talk about Medicaid. Medicaid is designed for low-income families and individuals, including children, pregnant women, and people with disabilities. Eligibility varies from one state to the next. Medicaid is intended to provide what's called comprehensive coverage, including doctor's visits, hospital stays, long-term care, and more. Now, some states have expanded Medicaid under the Affordable Care Act. This covers more low-income adults. Unlike Medicare, which is federally funded, Medicaid is jointly funded by the state and federal government. And states administer their own programs within the federal guidelines. Now, what this means is that the coverage and eligibility will differ in Medicaid from one state to the next. Navigating health insurance is super tricky, but get out a pen and paper because I'm going to share with you 10 tips to help you stay on track. Number 1, understand your plan. I literally want you to read the plan thoroughly so that you know what's covered and what isn't. Please spend particular attention to what are the exclusions and what are the pre-authorization requirements. Number 2, combat denials. If an insurance claim is denied, don't panic. There's a process where you can effectively combat the denial. Now, this takes some time and you oftentimes will pair or partner with your healthcare provider. You're going to need to read carefully why it was denied to understand the reasons. For example, maybe it was out of network, or maybe a prior authorization wasn't completed properly, or maybe there wasn't adequate documentation. You want to help your healthcare provider collect all that documentation, and they will oftentimes, on your behalf, apply for an appeal. Now, all insurance companies have an appeals process, and so you want to read carefully through the appeals process. You want to make sure that all the required documentation, like the doctor's notes and things like that, are included, and you want to pay particular attention to the timelines of when that appeal needs to be applied for. Lastly, be persistent. It's important to follow up. So feel free to continue to call the insurance company to find out how the appeals process is going. And please document each time you talk to them so you can keep track. Number 3 is to leverage co-insurance. So it's important that you understand your co-insurance requirements. This is the amount of money that you're going to have to pay after you've met your deductible. And so, for example, if your particular plan has a 20% co-insurance, after you've paid your premium and after you've paid your deductible, you're going to have to pick up 20% of that healthcare cost. And then that allows you to budget correctly so that you have the funds to do that. Number 4 is to use preventative services. Most health insurance companies provide preventative care at no cost, so take advantage of that. By participating in preventative care, for example, screenings, you can pick up medical problems early and stave them off before they become out of control and rather expensive to treat. Number 5, try to stay in network. As mentioned earlier, in-network services are provided to you within your insurance at a reduced rate. Going out of network can get really, really pricey. Number 6, keep accurate records. This is really important. Save all of your explanation of benefits, save all of your bills, and save all of your correspondence with insurers. This is going to become invaluable if later you have to fight a denial or a claim. Number 7, communicate with your provider. It's critically important that you verify that your provider is in-network, and you always want to discuss costs up front to avoid any unpleasant surprises. Number 8 is to maximize open enrollment. Once a year, there's an opportunity typically to change your plan. You don't want to let that opportunity pass you by. During open enrollment, spend some time making sure that your insurance is the kind that's going to help you the best in the upcoming year. If you need to change insurance products, you can only do that during the open enrollment period. Number 9, ask for help. Every insurance company has a benefits coordinator. Call them and have them help you navigate through this entire process. That can be really useful. And number 10, consider programs that will help you reduce cost. For example, if you're struggling to pay for high medication prices, there are programs like GoodRx. These are discounts and coupons which will literally help you decrease the cost for the medicine when you go to the pharmacy. Additionally, there's programs like the Mark Cuban Cost Drug Company, which bypasses some of the insurance costs and can make generic drugs much more affordable. Now, before we go on, I'd love to hear from you. Have you struggled with an insurance company and had a claim denied? If so, how did you navigate through it and what was the outcome? Please leave a comment in the section below. The viewers on the channel and I would love to learn from your experience. Now, when insurance coverage isn't enough to cover expensive medications, oftentimes the drug manufacturer themselves can step in to help. So here's a couple ways that they do that. Number 1, patient assistance programs. Many pharmaceutical companies will provide medications at a discounted rate or sometimes even free for patients that qualify. Eligibility is typically based on factors like the income that the home generates, the insurance product that the person has, and the medical need of the individual. Number 2, copay assistance programs. These programs cover copays, so they'll pay down the person's copay, and they can significantly reduce the out-of-pocket cost that that individual will have to pay themselves. Number 3, discount cards. Some manufacturers will literally issue like a credit card, a discount card, to lower the cost of the medication. Number 4, free samples. Physicians can sometimes receive free medication samples from the manufacturer, which they can give to the patient to get them started on a medicine at no cost. Advocacy and support services. Many drug companies have teams of people dedicated to helping you navigate through insurance issues, trying to find additional financial services and other ways of accessing medications. So call them. Collaborations with charitable organizations. Manufacturers will sometimes partner with charitable organizations to help fund programs to supply medicines at reduced cost for certain underserved populations. As you can imagine, some of these initiatives can make a world of difference in helping you start on a medicine that you need for your condition. I hope this video helped you demystify health insurance in the United States. Remember, it starts with you becoming informed. If you found this video helpful, do me a favor and give the video a thumbs up. And if you haven't yet subscribed to the channel, please consider doing so. As always, this is Aaron Boster saying thank you for learning about MS, and in this case, health insurance with me. And until my next Monday morning video or my next monthly live stream, be safe and take care.